Hello and welcome. My name is Marianne Sibaud. I'm an urbanist and business developer at ArchDaily, and I'll be hosting today's conversation. I'm joined by Clara Langevin, Teresa Reicher, and CeCe Putigo, who will be sharing their perspectives on how data and AI can improve the health of urban populations, as well as tell us all about the AI for Healthy Cities initiative's contribution to the topic. So before we delve into it, why don't we start by just hearing a little bit about yourselves, what you've been working on recently. How about we start with Cecile, and then we'll do Teresa and Clara.
Thanks, Marianne. Hi, everyone. So I'm CeCe Putigo. I work actually in Quebec, Canada, in order to facilitate access to health data for researchers, decision makers, patients, and citizens of all. I'm an associate researcher at the University of Montreal Hospital Research Center, and I work for the Quebec Research Fund in order to help researchers have access to health data, but also to integrate the FAIR principle within their process of research in order to make data accessible, reusable, and so on. Thank you. Very, very pleased to be here with you.
Teresa, would you like to give us an introduction?
Yes, hello everyone, pleasure to be here. My name is Teresa Reicher. I work as Associate Director of Population Health with the Novartis Foundation. The Novartis Foundation is a non-profit organization based in Switzerland, and our main mission is to advance population health through the use of data and AI. So I have been leading the AI for Healthy Cities Dialogues from the Novartis Foundation side. Besides that, I'm also involved in our in-country operational work, where we support population health initiatives. Namely, I'm involved in the work that we're doing in Sao Paulo and Brazil, in Brazil. And a little bit to my background. So I've got broad expertise in data science and the use of data for decision making. I have a PhD in epidemiology and specifically worked on using simulation models in guiding decision making in health.
Perfect, thank you. And Clara?
Thank you. I'm Clara. I am the project lead for the Center for the Fourth Industrial Revolution Brazil's AI and machine learning platform. So C4IR Brazil is an initiative of the World Economic Forum, the federal government of Brazil, the state government of Sao Paulo, and 6 private sector entities. Our focus is on looking on policy and governance for emerging technologies within Brazilian society. I work closely with the public sector. My main project is AI Procurement in a Box, which is one of the traditional World Economic Forum projects, which was published in 2020, which looks at practical ways that policymakers and public sector servants can incorporate ethical AI principles into their procurement processes. We piloted this toolkit in the Metrô de São Paulo, the São Paulo subway system, and I think more relevant to our conversation today, the Hospital das Clínicas, or the clinical hospital of the University of São Paulo, which is the main which is one of the largest research hospitals, public research hospitals in Latin America. And so my work is mostly based on how can we get entities to get ready to adopt artificial intelligence.
Wonderful, thank you. And thank you all once again for joining us today. So I'd like to start by laying down a bit of groundwork for the context that we find ourselves with regards to urban health. So starting with Teresa, and before actually moving on to discussing the role of AI and digital data, could you provide us with some insight into what you identify as today's key urban health challenges?
Yes, of course. So over the last decades, we've seen a shift in the global health burden with the rise of NCDs, particularly cardiovascular disease. And then, of course, in the last two, 3 years, now that's been quite a while, COVID, which is putting massive strains on health systems worldwide. And the core challenge underpinning all of that is that we do have care options now, even for COVID, but these don't reach everyone. So there are vast health inequities, and there is an unnecessary health burden in underserved populations. There are deaths and morbidity that could be prevented And rapid urbanization in cities only exacerbates these health inequities, where health systems can get overwhelmed of the increasing demands, and health gaps widen. And I would say this is really the core challenge of our time.
So I'm intrigued to know what these challenges might look like in the context of Quebec and Sao Paulo, where Clara and CeCe find themselves, being, of course, vastly different in terms of climate, economy, population size. It'd be interesting, especially when formulating policy recommendations, to understand the extent to which these urban health challenges are shared between different regions and different geographies. So starting with Clara and then following with CeCe, could you illustrate for us Sao Paulo's and Quebec's challenges in regards to urban population health?
Sure. So one of the big issues that we're working at CeCe Brazil in terms of urban population health, and actually we're working directly with the Novartis Foundation in projects that are tangent to their Better Hearts, Better Cities, is the disparity between the digital transformation initiatives between local, state, and federal governments. So to put it, I guess, into context, most Brazilians, they get their healthcare, their main healthcare providers are the city-run healthcare clinics. However, these really have a low level of digital transformation. Much of what's going on there is analog. It's not digitalized. There's no collection on data, on personalized patient care. So these are things that kind of hinder the innovation that can happen at the local level in terms of, bringing in new emerging technologies such as artificial intelligence. At the state level, we see a little bit more resources. We see entities such as the Hospital das Clínicas that have a high level of digitalization and therefore can incorporate these emerging technologies into their daily operations and patient care. And then you have at the federal level, you have this initiative called DataSUS to unify all the different data sources within the Brazilian healthcare system. But that hasn't yet happened, mostly because of this disparate access to IT infrastructure and data collection that all these different Brazilian public healthcare agencies have, going from the local healthcare clinics to the federal government. So how do we get everybody on the same level? And I think another interesting work with the Novartis Foundation is their AI maturity assessment, which talks about how maturity for artificial intelligence isn't just data collection and IT infrastructure, but it is sort of an institutional thing of how do you become a data savvy organization, even at the local level.
You know what I find interesting is that despite the differences between our regions, in Brazil and Canada, or Sao Paulo and Quebec, we have similarities in the challenges faced. I've lived in Brazil for 7 years and now in Quebec for 3 years. And there's some common issues that I can identify through what Clara said also about the digital transformation, because we face some changes that are so massive for clinical health centers, for the integration of data across primary care, secondary care, that we could work together. There are things that we can learn from one another. In Quebec, we have really some challenges that are related to equity, access to a physician, family physician is not something that's settled and that's doable for everyone. As immigrants, it's kind of challenging to have access to care that is really not only accessible, but adaptable to our health challenges or individualities. But regarding also, this is really connected to the kind of transformation we want in the digital side, because if you look at even hospital in Quebec, the digital transformation has advanced very fast, but there's still a lot of paper. And access to data also in the COVID-19 context, it's kind of vital. And we couldn't say that we have solved all of the problems with the digitalization in Canada. For instance, the results from tests, if you were COVID positive to COVID-19 or not, was inscribed in paper, then it was scanned into the dossier and so on. So it's kind of the prehistorical stage of digital transformation right now in Canada. And I can imagine that we are talking about urban health, but in rural health, it's even worse. And in regions where there are not infrastructure for digital transformation, I mean, it's something that it's not even thought of or completely underfinanced. So I think we have really common digital issues or challenges that we face across regions. And it's not only because we're in Canada that we can say we are so much advanced in comparison with regions like Sao Paulo, where I think that many think are much better structured in terms of healthcare than here. What I can see from the vision I have within a hospital is that we cannot manage to follow patients or citizens across the centers of the care they receive, you know, because we have so much a limited picture of people, individuals here in the hospital. We don't even manage to have access to the scans they did in another hospital. So the kind of data integration that we want, the great electronic health record that we need to build a safe AI has not arrived here yet, not even in Canada. So I think this is a major challenge we face when we talk about urban health.
So you mentioned the growing burden of cardiovascular diseases, inequities in health access, of course, COVID-19, and a lot of these challenges, as Cecile pointed out, appear to be shared across different territories. So of course, this points out the need for these challenges to be met with new solutions. And this is really where I want to focus this next part of the conversation, starting with Teresa. Could you speak to the possibilities that data and digital innovations like AI offer governments in terms of improving access to health?
Yes, of course. I think I'm a huge fan of data, also because of my background, and see the potential of this. And I think some of this was already just touched on now, which is, for example, the paper records of test results or patient paper records, which is, I think, the first area where data and digitalization can just bring huge advantages, which is making health systems more efficient. If data is collected in one place, then it's much easier for physicians across different levels of care to know immediately who the patient is that they're dealing with, and to transfer this information to specialists. Then data can help with the automation and standardization of care processes, and really just make health systems and care more efficient and more standardized. And then there are two additional areas where I see the great advantage of data and digital. And the first one, Marianne, you already mentioned, which is health outreach. So through, for example, the use of digital technologies, we can use those to reach the populations that we cannot reach through traditional care. So, for example, through the use of virtual care systems or chatbots, you can reach patients who don't come or cannot come to the clinic, either because they live in very remote locations, because they live busy lives and can't come to the clinic because of time, or because they're from marginalized communities and don't feel comfortable coming to the clinic. So chatbots and virtual care systems really offer an opportunity to reach those populations, to provide counseling, and to make healthcare accessible and approachable to those populations. And then lastly, there's, I think this is what we've also seen a lot during COVID. There is a great role for data and digital at the health system planning level. So more data means we can understand better what the challenges of our populations are in health, and what we're facing and how we can act on them. So what is the current greatest burden of disease? Is it cardiovascular disease? Is the population battling with cancer? Is it COVID? How is it distributed? Who is most affected? Which populations? Is there a subpopulation that we should focus on that needs more attention than others? And also it gives insights at care level. So, for example, where do we lose the patients? Why do they not, for example, achieve control of hypertension? Is it because they don't come back to the clinic? Why is that? So all of these different items are really difficult to investigate just by logic reasoning and in your head, and data can really help us map out what is happening and observe what is happening, observe trends, and act on those.
So I'm aware that the governments of Quebec and Sao Paulo have been funding science and innovation projects for quite a few years now that actually encompass data-driven initiatives in this realm, some of which have been done in partnership with each other. So it'd be great if we could hear about your respective governments and really what they've been advancing in the use of AI in the realm of urban health. How about we start with Clara, and then we'll hear from CeCe.
Thank you. So looking specifically into the projects that I've been connected with through the AI Procurement in a Box toolkit, the Hospital das Clínicas, which is our main partner in these healthcare initiatives, before we started working with them, they had this really cool project called ArchDaily, which basically they procured an AI model that would look at X-rays and try to support doctors' diagnoses of COVID through looking at X-rays of lungs. So that was a really great project that they started mobilizing their own data within their institution to be able to train these models, to be able to give chances to both large corporations and startups to retrain their models on on this type of data and inputs. And when we came in to work with them together, they wanted to expand this, so create a data lake that brought in a bunch of different data sets from all over the hospital, from administrative data to COVID-related data to cancer to all of the, I think, 60 different data sets into this data lake for the specific purpose of training and creating training and testing AI models from both internally, but also with partnerships with startups and with larger international corporations. And this ended up being even a bigger challenge because I think Cecile mentioned how it's hard to share data between local and state and federal government, also between different hospitals, but sometimes it can be difficult to share and integrate data within your own institution. So that was a big challenge that we looked at, basically seeing how can we create this data lake where there's a bunch of different models that can be created that are specific for the Brazilian context. And then with the idea that these models will not only just be used within the Hospital das Clínicas, but then will be allocated out to other hospitals, such as the local healthcare, the urban healthcare clinics, which are where most Brazilians have access to healthcare. So this was a way of seeing how can we democratize access to these emerging technologies, but it takes a lot of work because there are a lot of data. I think Teresa mentioned lots of analog stuff. There's a lot of systems that are still on paper. So how can we make this more inclusive and think strategically about data sharing in a way that's safe, but is a way that also fosters innovation?
Yeah, thank you, Clara. I didn't know all these initiatives throughout Sao Paulo, and I used to live close to the Hospital das Clínicas, so I know the neighborhood. Regarding Quebec and more broadly Canada, there have been like millions of dollars invested in AI development through superclusters. You know, they have recognized superclusters across the country, and one of them was around Quebec and dedicated to health. And the organization responsible for allocating the funds, organizing the project is Scale AI. So I've known many of the projects implemented through Scale AI because right here at the University of Montreal Health Center, we have implemented 3 big projects thanks to these federal funds, and following not only development in partnership with the company, but also implementation. And I think this is the most interesting conversation to have, because most of the fund, it's around $500,000 to $1 million for each project, is invested in development. So there is a keen partnership between the company trying not only to co-develop with the clinician managers, but also to customize the solution to the realities of the data, to the realities of the practices of clinicians and of the infrastructure of the hospital. And right after they develop the solution, they really need to make all this, adaptation, feedbacks, then the customization, the change management practices that have been implemented in order to make the system work, be safe, and so on. And 1 year after implementing the solution that was supposed to combat COVID, we still have not managed to integrate it perfectly with our infrastructure. So really the change management episode or investment we need to do regarding AI implementation, I think it's the most challenging to my point of view. And I'm also a researcher, at the hospital. So I study what we call implementation science, all the factors that could limit the use of AI, but also the solution we could develop in order to facilitate its integration into clinical decision-making, management decision-making, and practices at the patient bedside. And what we've seen that most of funds today are invested in development, but we really lack resources in order to finance what's implementation, use, measurement of impacts, and so on. This is really underfinanced. But despite all of this, I think decision makers are really taking account of the importance not only of to finance research through what we call the Canadian AI Research Chairs, but also what's called the social science, ethics, legal studies around the implementation of AI. I think that's the source of our conversation today.
So now that we've really laid the foundations, I'd like to turn the lens on the new AI in Urban Health initiative by the Novartis and New Cities Foundations. So Teresa, what is AI for Healthy Cities and what does the project seek to achieve?
So the AI for Healthy Cities Dialogues are a forum for exchange between cities on AI for urban health and well-being. There is one sentence, Cecilia, that you said that really resonated with me just now, which is, we have so many similarities, we could all work together. And that is exactly the aim of AI for Healthy Cities. So we launched this launched these dialogues last year in 2021, the New Cities Foundation and the Novartis Foundation together. And so what we've been observing through our work and what we know is there's so much knowledge on data and digital innovations. There are so many opportunities that are being used in different cities, and governments around the world are actively really harnessing the power of AI to improve the health of their populations. And we believe that this knowledge should be shared. Like, for example, Clara, the example that you gave on using machine learning on X-ray images of COVID. This is a fantastic example of a case study that should be shared between governments and should inspire others. And this is why we launched AI for Healthy Cities, to offer a forum of exchange between cities, for cities to talk to each other, to inspire each other, and to learn from each other, to really create a living dialogue on AI in health.
So I understand that one of the key parts of the project were the workshops that you guys organized. And the aim of this was really to discuss the challenges and opportunities as well that different participants from several different sectors were identifying. So the idea with those were to formulate recommendations for governments to implement AI in urban health policy. And this is something that I'd really like to delve into now, because we actually have CeCe and Clara here who were directly involved in these workshops. So one thing I'd like to ask CeCe, just to start off, is with the fact that we had, or you had workshop participants coming from a variety of different sectors, did you find that there were any shared challenges, again, going back to those commonalities in trying to find a way to foster an artificial intelligence ecosystem?
Yeah, I thought the workshop were really interesting. And that was the first time ever that I discussed with people so many countries, especially from Brazil, around AI, because when I was living in Brazil, I was working on social entrepreneurship and fashion design. So something that's not in common with AI. And what brought me all those insights about commonalities is because we talked about the same issues. First, we talked about the data quality, data representativeness, and the importance of building data that is actually common to the ones that will characterize the users of our systems. So I've seen that, as Clara mentioned, the issues of preparing quality data and training algorithms in order to make them useful is something that we face and experience as much as in Sao Paulo as in Quebec, when we try to implement a system within a health center, clinics, and environment. Another commonality that I identify is the question of training, because the clinicians, the managers have some apprehensions regarding the use of AI. Sometimes benefits are really let's say, presented with that justification. And when you talk about with scientists, clinicians, people with lots of years of experience, and you say, okay, it's going to save you tons of hours or improve your work, at best, they just refer to the traumatic experience of implementing an electronic health record within their hospital. And for them, digital transformation is not something that sounds that positive. So, you know, the justification of AI, I mean, showing really the benefits that are presented by the literature, presenting the challenges, discussing the legal, ethical challenges is something that is not done enough, as much in Brazil as I think is as in Canada or other jurisdictions that we discussed during the workshops. And I think during the especially discussion I was in, we really talk about the use and implementation of the AI system. And that was something that was really much discussed. I mean, besides the question of training and sensibilization to the impacts, that was, okay, how can we ensure that what is developed in research, in the academia, or in companies is really felt as useful, as safe, and experienced as positive by patients and clinicians. That was something that I've seen, and that's why, as Teresa said, I mean, looking at the commonalities, we can learn so much from one another. And I think that's the point of organizations like or initiative like AI for Healthy Cities to give us insight into how to partner with one another in order to learn from what solutions were developed in an environment in order to apply it to another one.
I'd like to pick up on a point that was mentioned in the report and that Cecile, you touched upon just now. And that is that with artificial intelligence and machine learning systems becoming increasingly complex, they tend to actually hinder the explainability to users and sometimes even the data specialists themselves, which can actually build distrust in AI. So Clara, based on the workshops, and also based on what you've been working on regarding increasing AI adoption in both the public and the private sectors, to what extent would you say that this distrust, this potential distrust in AI is a barrier to implementation? And if so, what possible solutions could be offered to minimize this hindrance?
I think that's a great question. I think we've discussed a lot about the benefits of artificial intelligence to healthcare systems, such as the Hospital das Clínicas Hadvid COVID diagnosing model and others, chatbots also to connect patients to different care. But there are several different risks to the use of artificial intelligence that are important to be discussed with when we're creating these policies and creating these projects. So looking, I'm sure everyone who's listening has heard of all these different AI projects in both the private and public sectors and all different types of themes such as public security, immigration, where there has been certain negative impacts to individuals in society. And this is the same for healthcare. So in healthcare, you do sometimes have projects where there have been negative impacts on individuals in society. So for example, in the United States, it's very common to use an AI model to manage high-risk patients, so especially those who have chronic illnesses. So basically, this model suggests which patients should have more specialized care, so which should have more one-on-one care with a specialist, which should have more contact with the nurse. And basically, in the United States, what happened a few years ago is that some researchers from, I think, the University of California, Berkeley, looked at the disparity of care between white patients and Black patients. So basically, the model decided that white patients were more risk and therefore more worthy of care. And so you started getting this disparity of care allocated to white patients versus Black patients. And it wasn't because race was in the data inputs. It's because traditionally or systemically in the United States, white patients tend to spend more money in healthcare organizations than Black patients because of the systemic racism that exists in Brazil and in the United States. And things such as distrust, such as lack of access to healthcare. And because of that disparity of how much money was spent in the healthcare, the model decided that that was an indicator of risk. So you see that there are these different problems going on within, there's a reason to be a little bit distrustful. And we see that both reflected in society, which sometimes will feel distrustful of using a chatbot, of using or getting care if they know that their diagnosis might be impacted by a machine learning algorithm, as well as the policymakers and those that are in charge of having these projects. They are fearful of a negative impact that will then both affect their career and affect their organization's reputation. And then not to mention the actual healthcare professionals that might be using these technologies and are always second guessing the technology, or also second guessing their own decisions, and may, decide not to use these technologies. Like that with the Hospital das Clínicas COVID project, that was one of the issues, is that some of the doctors didn't want to use the COVID model because they thought that they didn't really understand how it worked, so they didn't want to incorporate it into their daily operations. And so some of the things that we've looked at how to, I guess, build confidence in the use of artificial intelligence, we actually took a cue from the federal government of Canada through the use of algorithmic impact assessments. So an algorithmic impact assessment is basically a tool that a policymaker or a public sector servant can use to realize what sorts of risks they have in applying artificial intelligence in that context, looking at both what kinds of impacts it could have on individuals, what kinds of data this will be used, if it's unstructured data, if it's data from another organization, and other issues that are related to these ethical risks, but also the institution's capacity of mitigating those risks. So is there going to be an auditing system? Is there going to be, is there already data protection legislation put in place, or at least data protection protocols within that institution that'll help mitigate any kind of risk that could happen? Or how do you create a team to monitor just this algorithmic tool in order to ensure that there aren't any distortions or any biases playing out in the field? So that's something that's really important. And usually we suggest that that's published alongside a request for proposal for an AI project. And that in that way, we can ensure that both the public sector has a conversation with their future suppliers and developers on what are the risks and how can we work together to mitigate that risk. And also communicate to the public at large that, yes, there are risks, but we know and we're working on it, on mitigating these risks. So tools such as that to have this conversation on what are our risks really put in this idea of ethical AI into practice and helps build up confidence in the use of artificial intelligence.
So just hopping back to the topic of the AI for Healthy Cities report, and as Teresa was mentioning previously, the findings from the research, from the conversations that emerged as well from the workshops, were consolidated as a set of recommendations for cities to realize the potential of AI in urban population health. So Teresa, as one of the report's co-authors, could you walk us through some of the key takeaways for an ethical approach to deploying AI in urban spaces?
Yes, of course. And actually, I find it, just to come back real quick to the example that Clara just told, because I think that was actually a beautiful story that touches on a lot of the recommendations that were developed during the workshops. Because some of the recommendations were quite practical. So it's about creating partnerships, sharing knowledge, connecting the dots. So creating multi-stakeholder collaborations and multi-sectoral collaborations, so that knowledge from different areas is incorporated, inclusion of different populations to make sure that models are comprehensive enough. Then we have recommendations relating to funding and policy. So creating kind of the fertile ground that supports the use of AI and digital solutions in health. Then we have recommendations on capacity building to make sure that the fertile ground can be used, so that there is enough technical expertise, both in the general population and in government, and in essentially all stakeholders involved, to exactly avoid that example of a physician saying, oh, but I don't trust the algorithm because I have 50 years of experience or 30 years of experience in this field. How can an algorithm be better? That's why physicians and other stakeholders should be involved from the very beginning in the creation of AI solutions. And that's also why we need to talk about them and why we need to make sure that they don't become some sort of black box, but that these solutions are approachable. And then we addressed in the recommendations also infrastructural requirements on data sharing, open access data, interoperability, and so on and so forth. But what was also very clear in the discussions and in the recommendations that were distilled from the discussions are the limitations of AI. And here comes back to what Clara was just saying. So we have to really make sure that these digital solutions serve all people. So there is need for regulatory frameworks. I think the example of requesting like a risk assessment alongside proposals is a fantastic example of using regulatory frameworks to mitigate the risks of AI. Then there was the overarching theme of ethics and equity and inclusion. So making sure that, for example, training sets of for algorithms are inclusive of all the populations that the algorithm will later serve. And also data privacy was a big issue that was addressed in the recommendation. So how to make sure data is being used, but also the privacy of the individual behind the data is preserved. Because at the end of the day, I think these are really important, especially with making sure that solutions are equitable, because we want to foster data and digital solutions to improve population health for the entire population and not just for some.
So we're coming close to the end already. And to wrap up, I really would love to hear from each of you unique experiences and perspectives regarding the direction for AI in the future. So I'm going to borrow a question actually that was explored as part of the AI for Healthy Cities workshops. I'm going to start with CeCe, and then we'll go with Clara and Teresa. And the question is, what is your main expectation for what you would like to see happening in the field of AI in urban health over the next 5 years?
Wow, what a question. I think we can be, ambitious, but realistic, because today, unfortunately, most of the AI systems that are being developed in research are never really used at the bedside. And one thing that I think we don't invest enough, and I'm preaching for my parish, is in management. You know, I give management courses to researchers here at the hospitals in order to show the importance of, directing change, changing our infrastructure of governance, including the perspective of plural actors within decision-making, all the things that are considered for them as soft skills or secondary skills are in fact essential when you want to implement and direct a project that is quite considerable. And when you want to implement an AI system, when you want to actually to make a new technology used in practice, you really need to invest as much in the technology, which is quite digital or medical technology, as in fact in the practices, in training, in questioning and understanding the needs, aspirations of people. And right now in AI, I think the discourse is really technology-centered, deterministic, and we need to change that into, okay, it might be something really advanced, little explainable, we have lots of ethical issues, and we have the job to achieve. But we also have the job of understanding that this is not going to solve everything. There are many problems that will not be solved at all by technology. And if you want to apply this kind of pattern of AI will solve everything, people are just going to be even more trustless or questioning, the rationality behind. So let's not be deterministic. Maybe listen more to what the problems of a health systems are for real, and see if AI cannot be adjusted or developed in response to what let's say the ground is telling us. So that would be my actually one wish, is to maybe better take back the question coming from the system, the clinics, and the citizens, rather than trying to apply, patterns or solution from above.
Thank you, CeCe. Clara, could we have your thoughts on the question?
Yes, of course. I think for me in the next 5 years, what I want to see specifically in Brazil is the institutional maturity to be able to adopt these technologies. So going back to some of our conversations about cross-sector, cross-entity, or even intra-entity collaboration to build these data sets and get to that level of IT maturity needed to adopt artificial intelligence, to topics such as regulation and governance to ensure that the use of these technologies is safe within the healthcare sector or within, the public sector or society at large, going through ideas about capacitation, making sure that everyone has the training from healthcare providers to administrators on how to actually use these technologies in a way that's safe, in a way that they feel they trust these technologies. So I think Cecile made a really good point too about having the maturity to decide if artificial intelligence is actually right for the context. Something that we see a lot in innovation or government innovation is that a lot of times people innovate just to innovate because obviously it's trendy to adopt artificial intelligence or adopt a system using sensors and wearables, but is it actually something that is connected to a specific problem that the healthcare sector has to resolve? I think there's something like 90% of AI projects actually fail because they don't have a specific objectives. You can't just innovate to innovate. You have to have an objective. And I think that's the kind of maturity that I want to see in the next 5 years, both in Brazil and abroad.
Thank you. And finally, Teresa, what would you like to see happening in the field of AI and urban health?
So I love data. I love AI. I think both of them are so powerful. And I think what I want to see are more open conversations and open-ended conversations. So not just hailing everything digital, but thinking about, is it useful? Does it serve the problem? And then having these open discussions between people from different countries, between people from different fields, to make sure that both the patient, the physician, the governor, that everyone understands what we can use AI for, and that it becomes more than just a fancy buzzword, and that we can actually use it to address the pressing health challenges of our time, specifically, I would say, around health equity and making sure that care reaches all. And I think we should use data and digital solutions for good. And that's also why we're actually we are expanding this network, the AI4HealthyCities Dialogues, this year, to further these discussions, especially on health equity, including more people from more cities, to bring everyone together in an open dialogue and in an open-ended dialogue as well.
Fantastic. Well, a huge thank you to all of you for taking the time to join the conversation today. And of course, for your incredibly important work in advancing the implementation of AI to improve urban health. Big thank you as well to New Cities for bringing us all together. And I hope you all have a wonderful rest of your week.